Hi, everybody. This is Dr. Corolla Okogbaa with Louisiana Center for Eyes in Baton Rouge, Louisiana. Thank you so much for joining me today. For those who don't know me, I am the founder of Louisiana Center for Eyes, where we help individuals reach their best vision so that they can maintain a healthy eyesight in order to continue to live and do the things that they need to do. So today on another episode of Eyehealth Conversations with Dr. Okogbaa, we're gonna answer a question that I get a lot of. And so today we're gonna discuss sickle cell anemia or sickle cell disease. And the question is, Doc, I have sickle cell and I would just want to know, is this something I can get eye problems with? And so we're going to answer that today. And so I wanted to also let you all know if you want to get more information, please subscribe to my YouTube channel at Louisiana Center for Eyes. Also, our website, www.lacenterforeyes.com. All right. Very good. Let's dive right into it. Well, what is sickle cell disease or sickle cell anemia? Well, it is an inherited blood disorder, right? It's inherited and it's very, very common in African Americans. Okay, one out of every 365 um, people in the United States that is African American has sickle cell, and so it's very common. It's inherited, and so we know it can cause a lot of problems to different organs in our bodies. So today we're going to discuss the eyes and how sickle cell can impact your eyes and your vision. Okay. And so, what is it? Well, what happens in sickle cell disease is that um, individuals have hemoglobin that is abnormal. We call it hemoglobin S. All right. And this red blood cell hemoglobin, the hemoglobin that in those red blood cells become sickle shape, like crescent shape. So they don't flow well and they don't move well through your blood vessels, and they can clump up and clog, especially your tiny blood vessels. Okay. And we know that the eyes have a lot of tiny blood vessels, right? The eyes get a significant amount of blood for it to function. And so when you have blood vessels that gets clogged up with these sickled cells, okay, these sickled or abnormal blood vessels, well, they can clog up those vessels and then cause that organ or that tissue to not get enough blood. And whenever a tissue does not get enough blood, it gets damaged and it can cause necrosis or bleeding, or just not, it doesn't work well. Okay, so the same way they get this what they call vaso-occlusive disease, or crises and things like that. Well, the eyes, and so it can impact the eyes from the front part of the eyes all the way to the back of the eyes. And so it can, so when someone comes to the emergency room and they have something called hyphema, where the doctor's looking in somebody's eye and they see blood, usually the very first thing that's on our list of differential is sickle cell, right? Because it's one of those things that can cause these little blood vessels to start growing, abnormal blood vessels start growing, and cause bleeding. And so hyphema in an eye, that shows up immediately, that's typically, we've got to rule out sickle cell. Okay, well, what else can happen? Sickle cell anemia can cause cataracts to grow faster. It can cause, um, iris issues. It can cause back of the eyes, what we call non-proliferative retinopathy, where you start having little bleeding. There's specific signs we even look for that's very common in retinopathy that's from sickle cell. Okay, and so all of this can even lead to having retinal detachments in the eyes. And so these are some of the things that can happen to the eyes. But what are some of the symptoms that you may notice? Usually most people with blurred vision, you can get flashes and floaters, and dark curtain, dark shadows coming over your eyes. These can also signal other things, but if you have sickle cell, definitely that can those are signs to look out for. You need to see a doctor, like eye doctor, like right away if you start seeing those type of signs and stuff like that, or symptoms, or noticing these changes in your vision and eyesight. And so, yes, so sickle cell anemia can definitely cause issues to the eyes and the health of the eyes. So, the best way really to catch it early is to make sure you get your annual eye examination. Okay, because sometimes you can have things that are happening and they're what we call asymptomatic, right? So it could be impacting your eyes, and you don't know it because it's not causing any symptoms right away. And so, but if we catch it early, we can do certain things. Typically, if there's retinopathy, if there's bleeding in the eye, we can catch it early and start treating that. We could do lasers. There's certain medications now where the doctor can inject in the eye called anti-VEGF medications to help these blood vessels or abnormal blood vessels to start going away. And obviously, if there's retinal detachments, if we're to that degree, then even surgical management or getting surgery is also an option at that point. Okay, and so I just wanted to kind of educate you today on sickle cell and how it can impact the eyes. That yes, because the eyes have a lot of tiny blood vessels, these sickle cell can also cause problems to these blood vessels, and potentially cause vision problems or even vision loss. And so if you found this information helpful, please share it with somebody. I would appreciate that. And if you have not had an eye exam in this past 3 months of the year, right, of 2023, or last year, or if you're looking for an eye doctor and you happen to be in the Baton Rouge, Louisiana area, look us up. I'd be happy to help you on your journey, help you with your vision and maintaining it and keep it as healthy as possible. All right, you can find us at www.lacenterforeyes.com, or give us a call at 225-356-2655. Thank you so much and have a wonderful day.